Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to this segment of Healthcare Consumers and Radio. We're very pleased to join this morning's guest, one of the industry leaders who's got a lot of experience in leading companies in this healthcare consumerism space. And joining us on the phone today is Dean Mason, CEO of Acclaris. Dean, good morning.
Good morning. Thanks for having me on.
Yeah, nice to have you on. Dean, give our audience a little backgrounder on yourself and on Acclaris, and then we'll kind of jump into this defined contribution discussion.
Sure. First and foremost, Acclaris we've been around for about 12 years. We are a consumer healthcare ben admin technology and services provider, and where we're a little different than some of the other players in the market is not only do we provide a administration platform that we've built over the last 12 years, but we also have a complete services arm so that we're able to partner with companies like SelectQuote, but also Bank of America, Xerox, Fidelity, and many others, where we actually provide them the adjudication services, call center services, a full range of administration services so that they can focus on their core mission and allow us to bring our expertise to bear under their brand to deliver outstanding services.
That's excellent, Dean. Talk a little bit about what you see, and you've touched on some of it. So what do you see some of the real challenges that employers are facing right now when managing and implementing employee benefits, and why are they so excited about or interested in looking at defined contribution?
Sure. I mean, first and foremost is the issue of rising healthcare costs, and this isn't just from their perspective as the employer and what's going to them, but also, frankly, out of just pure concern for their employees and retiree populations. And what has been demonstrated again and again, and I know you guys this is your mission in terms of talking about this, is that these consumer-directed plans, better than anything else, are able to move the dial not just on bringing those costs down, but also impacting the healthcare outcomes of the people who participate in them. I think the challenge that employers face, of course, is you have to spend a little more time as an employee or a retiree understanding how these plans work. But once you spend that time, you find not only are they more cost effective, but they work in a way that gets you more engaged in understanding what your health is like, what's driving the cost of that health care and maintenance of your health, and that leads to a better outcome all around.
Hey, Dean, this is Ron Bachman. Could you put some meat on the bones there of what you mean by a defined contribution plan?
Sure. We've been in a world, and this is particularly true, it's moving quickest in the retiree population today, where, if you think about a typical union plan, for example, they very often have just completely covered 100% of the cost, and so people go to the doctor or the emergency room or whatever, and they think about the fact that it's free, and that's called a defined benefit plan, which is they're paying for you to, cover your health care. In a defined contribution plan, the employer says, we're going to contribute a certain amount of money, and what's going to happen is we want you to make choices about how you spend that money in the way that's best for you. So if you think about defined benefit plans, there's typically a one-size-fits-all plan for everybody, and it may be fully covered, it may be partially covered, et cetera. And that is sort of a rough cut fit for a lot of people, but it doesn't necessarily meet the specific needs of folks who might have, for example, these types of plans work extremely well for people who have, set medical expenses. They might have special medical needs, and these plans allow you to very tightly kind of predict, what the expenses are going to be in any one year, as opposed to something where you have a co-insurance or a lot of co-pays, et cetera. Mm-hmm. And so it's really up to the consumer to get engaged and understand the choices and pick the plan that's going to be best for them, so that the population as a whole has a better, more tailored experience in terms of their specific healthcare needs.
Dean, you recently launched a joint solution with SelectQuote Senior focused on retiree benefits. Tell us a little bit about that relationship and the solutions that you're rolling out together.
Sure. We were really pleased that to have that relationship with SelectQuote. We've actually had it underway for a little bit of time now, and we got the announcement out there about it. But what that is all about is that the way that employers provide health insurance to their retiree populations is evolving very rapidly. And, seniors often struggle with the various complexities of today's insurance market. And so to address this, we partnered with SelectQuote and created this strategic partnership to really transform the way these retiree health plans are delivered. And what was critical about that was the amount of time we spent with SelectQuote, who are experts in that population, really understanding that population and partnering. And so, for example, we're very close with the people who actually go out and talk to these, retiree groups and explain to them what the various options are. And what they have is basically a exchange where they offer a variety of solutions. We power that exchange for them. And then what's particularly interesting then in that population, as the month-to-month premiums come in, we take those and then we pay the premiums for the seniors out of a defined contribution account, which their employer has put funds into. And so it eases the administration and making sure that those premiums get paid on behalf of those seniors. And if there's money left over, it rolls over. If there's incremental funds that are required because they've maybe selected a richer plan, then we deal with that with the seniors as well.
What are the challenges and thus the opportunities that you and your partner SelectQuote have seen early on, and how are you addressing those?
Sure. First and foremost, it's getting people to, understand that this actually can be a better deal for them. People are so used to, not having to think about it. And so you have to actually take time to work with them and present the information, which SelectQuote does in person, and then we do via our the exchange that we're providing with them, to make sure that they understand, what the costs are, where the fund's going, how is this getting administered, what the benefits are. And in many cases, what the seniors find is that what they actually end up with is more choice and better coverage than they otherwise would have had. But it's a change, and people don't like change, and it takes time to understand that change. And so there's, always some initial resistance. And SelectQuote's been a great partner working with us to kind of help bring this benefit to their senior populations.
Dean, at the core, it seems like you're a real technology guy. I mean, you got a computer science degree from Yale, and can you tell us sort of where technology is going from your perspective, and how it's going to make it easier, not just for processing of dollars or doing the paperwork, but how it's really going to help the employees out there better understand their benefits?
Yeah, absolutely. I do have as you mentioned, I do have a technology background, although the last 15 years I've really been more on the operations and delivery and business side of this industry. And what is what's happening right now that I find so interesting is that you have the traditional world of benefits admin, and then you had sort of this exchange world that was off there, and the two of off to the side, and then the two of them now are coming together. Yep. And the real winners in this are absolutely going to be the consumers, because we're going to have a much more integrated, seamless, end-to-end solutions. And so if you think about even just what's going on now, where folks go onto an exchange and 50 to 75% of those people, depending on what study you look at, select some kind of consumer-directed healthcare plan. And then, that's where the experience ends today. Well, as we roll forward over the next 18 to 24 months, not only are they going to select a plan that works for them, which is most likely going to be some kind of consumer-directed plan, but then they're going to immediately roll into a seamless experience where the month-over-month administration is tightly coupled with that, and it's a month-over-month experience, which is great for the exchange operators. It's great for the consumers, and it will really ease the experience of being in these types of plans. And the retiree market in particular, like you see with the SelectQuote solution that I described earlier, is leading the way on this.
So the heavy movement towards account-based plans, what do you attribute that to? What's the real key out there for maybe somebody who hasn't really bought into the concept of an account-based plan?
Well, I would say it's first and foremost that these plans work, but also I think initially when the ACA came out, it didn't look like it was really going to favor these plans. Mm-hmm. And what people kind of figured out along the way, including the administration, frankly, was that if we were going to deliver on the promise of reducing the cost of health care and offering low-cost options, these types of plans are far and away the best option to do so. In fact, one of my little pet peeves about the industry is that we call these high deductible health plans. And what I always try to say to consumers is these are actually low premium plans. Instead of selling the negative, we should point out the reason these plans work so well for consumers is that the premiums on these plans are lower. And if you look at what ends up in your paycheck, because you're not, your premiums are being taken out by your employer on a payroll basis. If you look what's happening when you switch to these plans, you're actually bringing home a bigger paycheck, and then you can use that paycheck to fund your out-of-pocket expenses, and at the end of the year, you actually end up with more money. And so as people are waking up to that and they sit down at the kitchen table and look at the economics, they realize, this only makes sense. And then add to that, from the employer's perspective, that the total health care cost is coming down and the wellness and the population health is going up. You got an absolute trifecta.
Hey, Dean, we've got about 30, 45 seconds to go. Want you to leave our audience with a takeaway or two, please. Yeah,
sure. These plans are absolutely here to stay. I'm incredibly excited about the future, not just for Acclaris, but for the healthcare market in general and for consumers especially, because this is absolutely going to lead to a better overall experience, more highly engaged consumers, where people actually understand how their choices are affecting their financial and medical health together. And so, the future is very bright for this.
Yeah, thanks, Dean. We really appreciate you taking time out of your schedule to join us today. Look forward to catching up with you again soon. Have a great weekend.
Thanks for having me on.
Hey, the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.